This is a WECT Cape Fear Business Break.
Megan Donahue here, talking with Dr. Adam Brown from Port City Neurosurgery and Spine. Good to see you, Dr. Brown.
Again, thank you for having me.
Let's talk a little bit about telemedicine and what patients can expect with that approach.
Well, at Port City Neurosurgery and Spine, we are doing telemedicine right now because of COVID. It's a very effective technique. Most of the problems that we see from patients, we get a great deal of the story from their history, what their complaints are, where their pain is. And they can describe that very well in telemedicine, where we have FaceTime interviews with them. And then if they've had an MRI, we can review the MRI right there and give them a plan for treatment that might involve medical treatment, it might involve physical therapy, or it might involve surgery.
I think it's great that you offer telemedicine, but I also know that you need to have that face-to-face with the patient prior to any procedure.
Absolutely. Seeing a patient face-to-face and putting your hands on them in terms of examining them and explaining the procedure you're going to do is so important when you're going to do a surgical procedure. You really need to be able to show them the MRI, go over a diagram, tell them about what's going to happen during the operation, what's going to happen afterwards, and really go over the pluses and minuses of the operation so they can make an informed decision.
And I know that you're practicing the precautions that are necessary during this time of COVID.
Of course. Everybody wears a mask, everybody gets temperature check. We're very careful in this day and age.
So it sounds like with the telemedicine and the precautions you're taking during COVID, that people can still get help during this time for their pain.
Absolutely. We want to get people over their pain and back to their normal activities.
Find out more, portcityspine.com.
This has been a WECT Cape Fear Business Break.